One of the causes of distrust is about to be gone. The state announcing today it will stop the information sharing agreement at the end of the month. Now, the deal was created back in April, giving the health department permission to give first responders the personal information of those who test positive for the virus. The idea, however, was criticized by Democratic lawmakers all over the state. 911 operators were given the information, and they were only allowed to share it if first responders were going to places with confirmed cases. It was voluntary. Some counties broke the agreement off early, and Metro was involved. Before Dr. Hildreth spoke with us, he got the chance to testify in front of a federal House committee. He reiterated the message he left with us. Because of fear and mistrust, systems like information sharing and contract tracing can sometimes prevent people from getting the care they need.
Earlier this month, and with the best of intentions, the state of Tennessee sent the National Guard into public housing to test residents. Not surprisingly, the people living there were apprehensive, and they stayed behind closed doors.
Between the 2 days of testing, about 500 people were tested in the 14 MDHA family properties. And between the 14 properties, they tell us they have about 4,000 units. We asked them if they thought the information sharing may have impacted the turnout. They sent us a response saying, in part, we were extremely pleased with the turnout for the free voluntary on-site testing in partnership with the state. Free testing has been offered for weeks across the city, but residents had requested on-site testing because they could not get to an existing site due to transportation barriers. The Metro Health Department has yet to make a decision if it will follow the state when it comes to this policy. News 4's Ryan Breslin has more on what that could mean.
The mayor's office says that they are in communication with the Metro Public Health Department. The health department tells me that they are still reviewing the state's decision. But here's what some city leaders say should happen next.
I think absolutely Metro's health department should stop sharing this information and should have stopped sharing it weeks ago. Really never should have started.
Metro Council member Colby Sledge says he's filing a resolution to call for the health department to follow the state's example.
There was bipartisan concern about this.
Council member Freddie O'Connell is looking at options as well.
I think after today's action, if we don't see a voluntary change from the Metro Health Department's perspective, then council's probably going to look further into what are the possibilities of our taking some action.
Both councilors saying when the practice of sharing COVID-19 positive information first began, they were told a lack of personal protective equipment for first responders was the problem.
Inventory problem with PPE has been resolved.
Metro Police telling us they recently got a shipment of about 21,000 masks, enough for 2 per officer and replaced as needed, which is why the council members are again turning their focus on stopping the policy because of the fear people in immigrant and refugee communities won't want to get tested.
We want to suspend the practice, protect people's privacy appropriately, and then we also want to protect our first responders appropriately when they are showing up to any scene for any reason.
Ryan Breslin, News 4 Nashville.